Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Septic arthritis is a serious infection. It affects the joints. This infection can happen quickly. It's crucial to understand this condition. Our joints are incredibly important. They allow us to move freely. When a joint is infected, it can be incredibly painful. This can severely limit mobility. Imagine waking up one morning with a swollen, red, and excruciatingly painful knee. You might have a fever too. These could be signs of septic arthritis. Early diagnosis and treatment are key. Septic arthritis occurs when bacteria, or rarely fungi, invade a joint. This can happen in a few different ways. Sometimes bacteria from an infection elsewhere in the body travel through the bloodstream to a joint. This is called hematogenous spread. For instance, an untreated urinary tract infection could lead to septic arthritis. In other cases, the infection might be caused by an injury that allows bacteria to enter the joint directly. A deep cut or puncture wound near a joint could create this pathway for infection. Surgical procedures involving a joint also carry a small risk of introducing bacteria. Septic arthritis often presents with a sudden onset of symptoms. One of the most common and alarming symptoms is intense joint pain. This pain is usually severe and localized to the infected joint. Swelling is another hallmark of septic arthritis. The affected joint will appear visibly larger than usual. This swelling is often accompanied by warmth and redness in the area. Other symptoms may include fever, chills, and a general feeling of illness. The infected joint is also likely to be very tender to the touch, and movement may be severely restricted due to pain. Section 4. Diagnosing septic arthritis, a doctor's approach. Diagnosing septic arthritis begins with a physical examination and a thorough medical history review. Doctors will ask about recent infections, injuries, and any underlying medical conditions. Analyzing a sample of the fluid from the affected joint is crucial. This is done through a procedure called arthrocentesis, where a needle is inserted into the joint to withdraw fluid. Lab analysis of this fluid can identify the presence of bacteria or fungi. Imaging tests, such as X-rays, ultrasounds, or MRIs, can also be helpful. These tests can reveal damage to the joint, fluid accumulation, or other signs of infection. Blood tests may also be ordered to check for signs of infection and inflammation throughout the body. Section 5. Combating septic arthritis, treatment options and strategies. Treating septic arthritis typically requires a multi-pronged approach. The first line of defense is usually intravenous antibiotics. These are administered directly into the bloodstream to quickly reach and combat the infection. The type of antibiotic will depend on the specific bacteria causing the infection. Doctors often start with broad-spectrum antibiotics that target a wide range of bacteria while waiting for lab results to identify the specific culprit. In addition to antibiotics, draining the infected joint is often necessary. This can be done through repeated arthrocentesis or, in some cases, surgery. Draining the joint helps to remove the infected fluid, relieving pressure and pain. Section 6. Preventing septic arthritis, protecting your joints. While not all cases of septic arthritis are preventable, there are steps you can take to reduce your risk. One of the most important is to promptly treat any infection, no matter how minor it may seem. If you have any cuts or wounds, especially near a joint, keep them clean and covered to prevent bacteria from entering. If you have any underlying medical conditions that weaken your immune system, work closely with your doctor to manage these conditions and reduce your risk of infection. People with certain risk factors, such as diabetes or a weakened immune system, should be particularly vigilant about seeking prompt medical attention for any signs of joint pain or infection. Remember, early detection and treatment are crucial for preventing serious complications. UMCC, your ultimate medical consultant connectors.